probably the majority of the population is going to be low or maybe completely undetectable in terms of things like akkermansia, because they're not getting fiber in and not feeding a healthy gut microbiome.
The next tier is C tier. And first, we can talk about eating organic food. We've already mentioned various foods. This could potentially be higher if it's your own organic food that you grow. Our garden is absolutely booming this year. We've had a huge spread of things that we're basically eating as fast as possible, and they're extremely tasty and organic. So it could be a bit better. The reason why it's lower is because it just tends to be more expensive, and it's actually pretty hard to qualify something as organic if my family and I harvested a whole bunch more from our garden, and we do have enough to where we're giving it to friends and family, and we took it to the farmer's market to sell it. We could not market it as organic.
Yeah, and it is complicated when you talk about organic, because you can put someone in a corner and say, well, would you rather have more or less glyphosate on your food? And well, the answer is like, well, yeah, less. Like, I don't want to be intentionally drinking Roundup. But at the same time, there's not a plethora of literature either that would compare organic to inorganic foods. Yep. So let's say you're eating some blueberries that had pesticides put on them at some point versus organic blueberries that did not. You're probably not going to be able to detect an effect size in a short period of time. So 12 weeks of either blueberries being added to the diet, those people are probably going to get healthier. So getting hung up on that is sort of a barrier to health for some people, and not something that we should overthink, even though it does get kind of sensationalized in the health social media spaces.
Yeah, and I suppose you could say, let's say you've already invested your money in everything in the tiers above this, then it is reasonable to do. That's not in a F tier or an R tier. And my family mostly does eat organic, but we've already invested in the other tiers of our health as well. And there's obviously a difference in something that's organic, where the comparable product is something that tends to not get a whole lot of pesticide on it, versus something that does. And yes, the dirty dozen is not perfect, but it's a decent rule of thumb. I think that's a good synopsis of eating organic food. Make wise decisions, but keep in mind that it's not necessary for everyone to have a long health span. You can eat things that are not organic as well.
Yep. And then next we have a GI map. So this is stool testing. You might be surprised to see this in C tier. And this is a tricky one because the optimal gut microbiome has not really been characterized, but we do know that there are things that are associated with good gut health, things that are associated with poor gut health, as well as systemic health. And probably the majority of the population is going to be low or maybe completely undetectable in terms of things like akkermansia, because they're not getting fiber in and not feeding a healthy gut microbiome. Yeah. So this can be a way to really steer someone's diet to target what they are missing in. But it's certainly not in our top tier. But there can be a number of advantages to stool testing. Yep. Choosing whether you're going to eat carbohydrates or fats off of stool testing, probably not particularly good. I know there are a number of companies that'll look at this and they'll say, oh, there's a lot of fat in your stool, so eat less fat, or things of that nature. There's a ton of these spin-up companies. I can't quite keep up with what their claims are. But the GI map is something that's been around for quite a long time, and I think has been validated, has had some data published. Mm-hmm. So for that reason, we think that is if you're going to get some gut testing, make sure that it has some scientific validation, have some publications, that sort of thing.
Yeah, we actually order a pretty high amount of gut microbiome and stool tests. Some of them also have a FIT test, which is a colon cancer screening test for 1 year. So that's a nice little inclusion if you're not able to, or you're holding off on getting endoscopy or a Cologuard. And there's a lot of other companies other than Diagnostic Solutions. GI Map, we just kind of use it interchangeably, just like you say, Kleenex is a tissue. So yeah, I guess some people would probably expect us to put this in a higher tier. But part of the reason why it's so low is it's a relatively high cost. Usually I think it's something almost $400 for a test, which is pretty significant because you can get basically every nutrient and vitamin in your entire body, including CoQ10, including your omegas, intracellular and serum, for about the same cost incurred. So for someone who doesn't have gut pathology, that's a way better investment. And a lot of clinics and a lot of places make you get a GI map or a similar test, regardless, even if you have had perfect gut health your entire life and no other reason to get one. So,
and if a patient tells me, it's like, oh, I eat Pop-Tarts every day for breakfast, I order DoorDash, and the only time I leave my house is to go through a McDonald's drive-through, I don't need a GI map to tell me that their gut health is going to be off. So, I mean, you can get a lot from looking at the pillars of health before you move down the chain and look at a bunch of extensive testing, which is why we emphasize, like you said, the micronutrient panel, which is the endpoint that we care about in terms of what your gut is absorbing or not absorbing.
Yep.